question number 3 is therapeutic communication. So in this question, we have a pediatric client that we're taking care of, and this client has injuries, now we need to read this closely, that are suggestive of possible child abuse, okay? So suggestive of possible child abuse. We're not saying that child abuse is happening, we're saying that it is suggestive of possible abuse. And we're being asked which of the following would be an appropriate response for the nurse to make to the parents. Okay, so this is kind of a delicate situation, right? We don't know exactly what's happening, but what do we need to do? If we don't know exactly what's happening, we think maybe something might be going on, but we're not sure. What do you think? We need to get more information, right? We need more info. Okay, so how do we do this? We want to do this in a very delicate way. We want to be good therapeutic communicators, especially when broaching sensitive topics like this. And therapeutic communication is not just something for mental health nurses, right? This is important for all nurses because we all have to talk to people, right? We all have to talk to families, and we want to do it in a very therapeutic way. So let's take a look at our excerpt here. This is from our therapeutic communication cheat sheet. And there's a couple things here I want to pull out for you. If we think of how do we be therapeutic communicators, the two biggest things is that we want to be non-judgmental and we want to use a lot of open-ended questions. And if we remember, open-ended questions are questions that can't be answered with a yes or no. So if I were to ask you, how are you studying for the NCLEX? That's going to give me a lot more information as to saying something like, did you only use one resource to study for NCLEX? That's just yes or no. It wouldn't tell me really much of anything. So open-ended questions are going to be really helpful. Let's go back and see if we can figure out which of these would be most appropriate. I see a lot of you are answering 3. So let's take a look at these and see if you are correct. Okay, our first option. Do you ever hit your child to punish bad behavior? Well, outside of this being a pretty inflammatory statement, this is a closed-ended question, right? And it's probably going to make the parent feel pretty defensive if you're just kind of outright asking them, do you hit your child? But it's a closed-ended question, so it's not going to give us a lot of information. And remember, we're kind of thinking maybe something's happening here, so we need more info. So I'm not a fan of number 1. So let's look at number 2. Your child's injuries suggest abuse. Did you cause these? What do you think? Well, again, that's a pretty inflammatory statement saying that it looks like you're abusing your child. Did you cause these? And then we follow that up with a closed-ended question. So again, that's going to make these parents feel pretty defensive, right? They're not going to want to talk to you if they're thinking that you're assuming that they're abusing their child, because we don't know if that's what's happening. So again, I think we can rule that out, right? We don't want to make accusations or make the parents feel defensive because they're not going to want to talk to us. Okay, number 3. How do you discipline your child when misbehavior occurs? What do you think? Stella, I see your comment. Rude nurse. Yes, we don't want to be a rude nurse. Okay, number 3. How do you discipline your child when misbehavior occurs? What do you think? I like this one more because we're just asking how, right? We're not implying that they're doing anything wrong. We're just asking what are things looking like at home, right? That's an open-ended question. There's no judgment there. We're just wanting to get some more info. Tell me more about that, right? So I'm liking number 3, and I see a lot of you had chose that as well. But let's make sure that we didn't miss anything. Let's take a look also at number 4. Your child's injuries will have to be reported to the authorities. This really isn't even a question, right? And remember, we said we want more info because we have injuries suggestive of possible abuse. Now, of course, if we do really suspect that abuse is happening, then nurses, right, as mandated reporters, do have to report that. But before we start jumping to we need to make a report, we want to assess the situation first, right? Get a better picture of what's happening before we decide if this is even necessary, right? So I'm liking number 3 as well. All right, should we see if we're right? Yes, we are correct. And you can see that only about 67% of users in our bank got this question correct. So you guys are doing really, really well.